Hi, my name's Olivia. I'm going to be doing my abdominal assessment. I just want to go ahead and scan the room because Mr. Filey is unavailable at the moment. Okay. Alright, so let's begin. So, as I stated, my name's Olivia. I'll be doing my abdominal assessment over Jordan today. I would check the chart to ensure I had the correct order to perform this assessment. I would provide for privacy, which I have done. I would wash my hands, put gloves on, and then I would identify my patient using two patient identifiers. Can you go ahead and tell me your name and date of birth today?
Jordan
And your birthday?
October 28th, 1990.
Perfect, thank you. So I do have the correct patient. I would tell her that my name's Olivia. I'll be the student nurse assessing you today. And then I would start with subjective questions such as, are you having any pain in your abdominal area at all?
No.
Any history of surgeries or trauma? No. Any painful, like urination or pain going to the bathroom, like bowel movements? No. What kind of, are you sexually active?
No.
No. Do you use any kind of contraceptives?
No.
No. Okay. So then I'm going to go ahead and lift up her stomach to assess. I'm just going to lift this up a little bit and pull this down. Sorry, my hands are a little cold. And so for inspection, it looks like it's flat. There is striae. The umbilicus is midline. Temperature is warm. Of course, my hands are cold, so everything's going to be warm. And then I'm going to go ahead and get started with the auscultation. Alright, so for this I'm going to listen in two places in each quadrant, so 8 times total. I'm going to be listening for any bowel sounds. Are you having any pain in your abdominal area at all? No? Okay, so we're going to start in the right lower quadrant. Alright, bowel sounds were noted in all 4 quadrants. They were not hyperactive. Normal bowel sounds is like 5 to 30 times per minute, and they fell within that range. I'm also going to auscultate for bruits. So I'm going to make a W, place it on the umbilicus, and the middle finger is going to be like the aorta that I'm going to listen to, and then the left and the right will be the renal veins that I'm going to listen to bruits for. And I'm going to use the bell side of the stethoscope. And then, so no brewery was heard. I would like to note that the aorta is a little left of the midline. And then now I'm going to listen for the iliac veins. So I'm going to make a V and go down on the umbilicus. And then those are going to be my 2 points to listen to. Okay, so no breweries were noted on the iliac veins, which is good. I would also like to note for like the bowel sounds, if I didn't hear any sounds, I would have to listen for a full 5 minutes. And then after that, if I still didn't hear any, then we would have a problem. We would consult the doctor. So now I'm going to go ahead and percuss. So with the stomach, you have to be careful because you'll hear dullness over like the liver tissue, over any visceral tissue, or like if they have any excess adipose tissue. And you want to listen like 2 times in each quadrant again, like you did the vowel sounds. And this is going to be tympanic predominantly, and this is because the air in the intestines actually rise when the patient is laying supine. Any pain or tenderness at all? No? Okay. So like I said, tympanic sounds were heard predominantly over the stomach. There were areas of dullness over like the liver and some of the excess adipose tissue. And now we are going to palpate. So you would want to ask your patient if they had any pain in their abdomen before you started, because if they did, that's where you would want to palpate last. So are you having any pain in your abdomen anywhere? No? Okay. So we're going to start with like a light palpation, and we're going to watch our patient's facial expressions throughout this to see if she's grimacing at all. Okay, and then we're going to palpate deeper, which is greater than 5 centimeters. Watching their facial expressions. Okay, so I did not feel any bulges or hard masses. I do not see any lesions on the skin, which is a good thing. And then we're going to go on to the pelvic area. So are you having any painful urinating, any bowel movements that are hard? Do you know usually the consistency of your stool? Is it like formed? Is it
Formed and soft.
Formed and soft. Okay. Are you having any problems with like any hemorrhoids, anything like that? Any blood in your stool? No. I would also, on the assessment, I would be looking for any redness, any rashes or lesions. I would want to note if the patient has any like bulges when she bears down. And then I would also want to assess like the anal area for any redness or lesions, rashes, anything like that. So is there anything else that I can help you with today? No? All right, well then that will conclude this assessment.